Hi there, I'm Dr. Adam Rodnick, chiropractor out of Commerce Township. We're here with Dr. Ron Lederman, orthopedic surgeon out of West Bloomfield.
How do you do? I'm great, thank you.
Glad to have you here. We wanted to talk today a little bit about my philosophy in our office, and a lot of times in the chiropractic community. We talk about how we take care of patients natural first, drug second, surgery last. And that there is absolutely a time and place for all three. Where a lot of people have a misconception that, chiropractors are way on one end and medical doctors are way on the other end, and it's not necessarily the case, that we can absolutely work together to get optimal performance for our patients.
Absolutely, I would agree with you. We value our chiropractic colleagues that can take care of patients in a non-surgical manner and get people better. Contrary to what many people think, our philosophy as an orthopedic group is surgery is a last resort. So coming to an orthopedic surgeon does not mean surgery. And in our case, we do everything we can to keep patients out of the operating room. And that includes relying on the expertise of our chiropractic colleagues and other physicians in the area that can help us with things that maybe we don't do.
And that's one reason why we specifically love to refer our patients to your office, because you work very well with us. Another misconception people may have is that when they're seeing a chiropractor, they can only see the chiropractor. When they're under physical therapy or under the care of a surgeon, they can only be seeing that person. And at the same time, we actually can co-manage at the same time. People can be seeing us while they're still seeing you, and we can actually correspond to each other very well. We send faxes back and forth. We send records back and forth so that we both are in the know with all of our patients.
I totally agree with you. And it's about working as a team and surrounding yourself with quality physicians, quality professionals that have one goal in mind, and that's to get the patient better.
And I know that even here in your guys' office and in your clinic, that not only are you surgeons that do pain management, but you even have some physical therapy as well, because you realize and recognize the value of hands-on physical medicine as well.
Absolutely. And we do so many things that don't include surgery, that don't involve surgery. Of course, when someone comes to us, we need to evaluate them, and that's often with some x-rays. Very often we get specific orthopedic views. We perform an evaluation. We have an ultrasound machine that allows us to perform ultrasound exams, especially for patients that don't want to go into a tube of an MRI. We can perform ultrasound-guided injections into the joint, whether it be the shoulder, the knee, the wrist, the ankle. And again, the whole concept is try and get people better without surgery.
That's fantastic. And I'm glad that we can also, we get copies all the time of your x-ray reports, your ultrasound reports. We take x-ray as well in our office. We have a nice digital video x-ray that we take in our office as well, which helps us to realign spines, get rid of misalignments and subluxations, and allows us to work very well with you guys as well.
I'm glad you mentioned that, because we don't operate on the neck and back. We don't manipulate the neck and back, and we would rely on your expertise in terms of alignment issues, how to safely and properly manipulate somebody. It's all about doing whatever we can do to address the patient's symptoms, restore their function, and allow them to get back to their life.
Well, that sounds great. Well, thank you for joining me, Doc. We really appreciate you here, and we look forward to working with you on many patients to come.
Thank you. I appreciate it as well.